just so everybody is aware of this, because this has really been, in some ways, a town hall and a forum for us as individuals involved in this to inform people of what's going on in our community. We have been contacted by the local blood center, Versiti Blood Center, and they have noted to us that there's been a sharp increase in demand for O negative blood. And so what we're asking is viewers or individuals in the community who have a history of giving blood or want to give blood at this time, that if you could contact the blood center because they're in need of blood. So again, and for those in particular who are O negative, if you could consider making a contribution, that would be wonderful. So I want to thank you for that in advance. Second, I want to go right to the testing, because we continue to see strong demand at both the north side location for community testing and the south side location for community testing. The north side location, of course, is at Midtown, and that's basically now north of the main buildings. You enter from 58th and Hope, which is just a couple blocks north of Capitol Drive and off 60th Street. You're basically 58th and Fond du Lac. That's the area where you can enter there. I know that there was a strong demand earlier in the day, and I'm confident that there have been literally hundreds of people who have been tested there. On the south side, the UMOS location, which is 2701 South Chase Avenue, has also had strong demand. And the fact that we're seeing so much interest in these two sites makes it much more likely that we'll continue to do this next week, most likely at the same sites. There's been some conversations about whether there would be different sites, but as of right now, it looks at least like we'll use those two sites. But I also want to remind people that these are not the only locations where people can be tested. We continue to want as our priority those individuals who are symptomatic to get tested. And now there are at least 17 other locations, and there's a couple of other locations that are basically cropping up as we speak for people to be tested. And these are for people who are showing symptoms. The two community-wide are for people with symptoms, but for also people who are asymptomatic. But the 17 spots where you could go to be tested, and you can find out where these spots are by calling 211. You can also simply go to impactinc.org, the website for Impact Inc., which is the 211 organization. And that will provide a map for you as to where the 17 locations are in the Milwaukee area for you to get tested. The testing, of course, is extremely important because it allows us to identify those individuals who do need more medical care. And what we are doing once the people are tested, Exact Sciences is taking that information back to its labs in Madison, and the goal is to contact people within 3, perhaps maybe a little more than 3 days, as to whether they've tested positive. You'll be contacted by a representative from a health department, most likely the health department where you live, but not necessarily the case, because what we're seeing is an incredible amount of cooperation and coordination among not only the 11 health departments in Milwaukee County, but also the state of Wisconsin, which has been aiding us in a considerable way, and we're very thankful for that. So you'll be contacted to find out more information and to help you navigate the system. Then after that, the tracing begins, and this is an important part of what we're trying to do, and I'm very, very pleased to report that yesterday we trained 88 individuals to help with our tracing efforts. This puts our group at over 100 individuals who now will do the follow-up tracing for those individuals who have tested positive. And when we say tracing, what we're referring to there is the individual who tests positive will report to the first caller as to who their contacts have been. And then the tracers will follow up and contact those individuals. We are going to continue to grow the ranks of the tracers. We are doing so by utilizing City of Milwaukee employees. The state has been very, very helpful. We've been working with nursing students and medical students. We've been working with the Weaver program, which is an organization or a program that deals with retired individuals who want to help us in that effort. But we view the testing and the tracing as the two components of this that we have the most control over at the local level. And when I say control, I'd say it's our ability to deal with the people who are here because we know the territory. And so we're going to continue to do everything we can to beef up the tracing program as more and more individuals become tested. And we know, as Dr. Weston will tell us, that the more individuals you test, ultimately the more people are going to test positive, even if the percentage is dropping, which we are certainly hoping and expecting it drops if you are testing people who are asymptomatic. So again, the testing is going very, very well right now. You can expect that this is going to continue. The tracing is really getting beefed up right now. The demand for blood is still very, very high. We ask people to be involved in that. We also are preparing in the event that the Supreme Court issues a decision today, tomorrow, sometime, because we don't anticipate that we are going to have nothing in its place. In other words, we don't know what decision the Supreme Court is going to make, whether it's going to uphold Governor Evers' powers or whether it's going to have a lag period in which local decisions have to be formulated. But we have not been wasting any time, and we've been working to have ready to go, if necessary, a local order that would deal with the reopening of businesses. And that's what our goal is. Our goal is to reopen businesses, but to open them in a safe fashion. And that's important for two reasons. One, if there was just a light switch and we said the businesses are reopened, there's absolutely no guarantee that people will have the confidence to go into businesses. So we have to make sure that people not only are safe, but that they feel safe. And so we're continuing to work cooperatively among the different among the different health departments here in the Milwaukee area and beyond. So with that, I'm going to turn it over to County Executive Crowley, who chose just an amazing time to become the county executive. He hasn't had the opportunity to sit back and relax, but I think he's ready for the task. County Executive Crowley.
Well, thank you, Mayor Barrett. And I guess just to stress a few points that the mayor touched on is one, we continue to see interest in the new testing sites. And so we're going to continue to work with the National Guard to evaluate the need for continued testing in these locations. And so, they are available to continue supporting us next week. And so the locations, again, is Midtown and UMOS. So they'll be available up until Saturday, but will be closed on Sunday. However, again, if you are feeling symptomatic, we highly encourage you to visit one of the 17 testing sites. But instead of just going in, make sure that you call 211 so you can have an appointment to go in there. Okay. And so you have all 5 community health centers and many other private healthcare centers who are offering testing. So let's make sure that those who are symptomatic are doing that. And as we continue to talk about businesses, I guess I can give a quick plug for the Milwaukee Black Restaurant Week. This week is the 5th annual week of Milwaukee Black Restaurant Week. And so we want to encourage residents to patronize not just Black-owned businesses, but all businesses throughout the city and show their support during these trying times. And so if you're interested in taking a part of that, please visit onmilwaukee.com to see a list of those who are participating. But take advantage of curbside pickups and make sure to wear a mask and practice physical distancing. Just to give a quick budget update as well, as many of you know, COVID-19 is having a huge impact on our budget. And so the costs directly related to COVID-19 have already reached about $40 million. And over the past decade, earned revenue like the zoo and traveling beer gardens has been a core to Milwaukee County strategy to address some of these ongoing fiscal issues. But if we can't open the beer gardens this summer, we can't get the revenue. And so we definitely understand what many businesses are going through. And so we've made some changes to address some of these fiscal shortcomings, making tough decisions like furloughing seasonal and other employees, but it's not enough. We'll have to cut more because this is not sustainable. We're estimating about $100 million in lost revenue by the end of 2020. Future cuts will be directly impacted on our ability to continue to do what we need to do during this pandemic, whether we're talking about getting over it or the recovery phase. And as the next round of cuts will likely impact first responders and other necessary resources we provide to our community, like our behavioral health division. I had an opportunity to visit them yesterday, many of our nurses and frontline staff, to say thank you for the work that they're doing for our most vulnerable populations. And so, BHD does a lot for, many individuals, whether they're children or adolescents and adults in this community. They need to make sure that we have the behavioral health division during this time of crisis. And we need to be able to provide those services, as well as transit. Offering the public transit is critical to many folks to make sure that those essential workers can continue to do what they need to do for this community. We will continue to work with the governor, as well as the federal delegation, in securing additional and direct funding for local governments so we can continue to provide these critical services to all 19 municipalities. But as we continue to do this, know that, while we are in a critical phase, we continue to deliver critical services throughout this pandemic. And it's obvious that policymakers all across the country, in my opinion, are taking this serious. So, with the proposals now in the House and the Senate, I think that this is a bipartisan issue. We need to get both parties involved, and I think they want to help residents and ensure that they have access to critical county resources. So we have to continue to focus on what folks can do for local governments who've been on the front line. And really quickly, and then I'll stop, just to give you an update, is that we have asked the governor and the state of Wisconsin for the necessary funding to protect the health and safety of our residents. So that includes returning $103 million of funds to Milwaukee County that was authorized by Congress and signed by the president through the CARES Act to Milwaukee County, and providing flexible funding, direct flexible funding to all county governments from the state of Wisconsin currently allotted for coronavirus relief fund. So with that, I will pass it over to Dr. Ben Weston. Thank you.
Thank you, Mr. County Executive. Good afternoon. First, to our numbers, we have 4,336 cases of COVID-19 in our community and 227 individuals who have died as of today. As we consider the state's Badger Bounce Back Plan and local discussions on scaling back the stay-at-home orders, there have been questions about how quickly we can get back to business as normal. And though we all feel the mental and social, as well as in many cases the financial and medical impact of this pandemic and the associated stay-at-home orders, we know that the most marginalized and under-resourced communities suffer the greatest burden of these times. That said, we're all anxious to get back to a more normal way of life. And as we think about how best to move forward, how to ease back into our economy and our social interactions, we must balance the health needs of the community with many other interests and many other valuable needs, chiefly cited among them the economy. I'll tell you, I'm not an economist. I'm not a business person, so I won't make recommendations and share thoughts on those subjects. What I am is an emergency physician and a public health physician. And in those roles, from those areas of training and those perspectives, I see it as critical that we move forward to reopen our businesses and pull back our physical distancing in a measured manner. This pandemic is unlike any public health crisis that we've faced in modern times. One of the key aspects that differentiates it from other crises is the lack of shareable resources. So when a community suffers a tragedy such as a hurricane, a bombing, or a more localized disease outbreak, they may exhaust their supply of personal protective equipment. They may overwhelm their health systems and their EMS system, and they may lack the public health infrastructure to keep up with their needs. However, in those times, they can be made whole by those around them. Masks, gloves, gowns are shipped in from neighboring states and communities. Physicians, nurses, and other healthcare workers are flown in to support. Neighboring hospitals open their doors to accept their patients. This is the safety net that we have in this country in times of disaster. However, with COVID-19, every community, every hospital, every healthcare and frontline worker in the country, and for that matter, the world, is affected. With COVID-19, we do not have this safety net. And we have worked to increase capacity in our 911, our EMS, and our healthcare systems. We've worked to create availability of testing and ability of tracing, and we've worked to collect and enhance supply chains of personal protective equipment. Though we're at the end of a peak of COVID-19, we are only at the beginning of the pandemic. We've built up a lot of local capacity, but we must remember that we do not have this safety net to which we have all become accustomed. A misstep at this time will lead to cases, it'll lead to deaths, and it'll lead to a step back in our forward progress toward normal. We're at a fragile period, a critical period with this pandemic, and we must proceed with understanding, with humility, and with caution. Thank you, and stay safe, and I will hand it off to Ann Christensen, Department of Health Director for the North Shore.
Ann, you're still on mute. You would think that we'd know how to do this by now. Ann Christensen, I'm the director of the North Shore Health Department, serving the communities from Shorewood up to Brown Deer. A pleasure to represent the 11 public health departments in Milwaukee County. And I just wanted to spend a few minutes talking about testing. As mentioned, we've seen a tremendous increase in the number of tests and number of people tested. And in our health department, we've been getting a number of questions about what do those test results mean. And again, I wanted to take this time to really clarify for people so that they understand what those results mean in terms of your own risk of exposure and your own risk of disease. So for those who do test positive, you'll receive a call from your local health department or potentially the National Guard or the Department of Health Services. That's the state health department. And those individuals and those health departments can help you determine what your next course is in terms of how long you should be isolated, getting in touch with your employer so that you can remain off of work for that period of time, and just helping you navigate your signs and symptoms through the course of your isolation. If you, while you wait for your test result, though, you should also stay isolated. So it's really important that you are not out and about in the community, especially if you have signs or symptoms while you wait for those test results. Oftentimes what we hear is that people were tested and then they remained at work or remained out in the community. And then our work as contact tracers becomes much more extensive in having to track back and follow up on all those individuals during that period, because that would be a period where you're infectious. I think where it gets confusing for people is those negative test results. And just today we had a call from somebody who said, I tested negative, and so can you tell my employer that I'm not going to get COVID? And I really want to help people understand that just because you're testing negative does not mean that you're not at future risk for getting COVID-19. That's a really important message. A negative test is just an indication of that moment that you likely don't have the disease. So that's something that to be made aware of, that you're not going to be, just because you're negative doesn't mean you're not going to be at risk for getting the disease in the future. Also, negative test results does not mean you had it in the past. There are other tests for that. Those are the antibody tests that are still being assessed by the CDC. And when those tests come on and are made more widespread in the community, those antibody tests will be able to test your blood to determine if you've got the antibodies for COVID-19, which will indicate that you had it in the past. So the tests that are being done right now at the testing sites mentioned today don't indicate that you've previously had the disease. It would only indicate at that moment in time that you're tested that you have the disease. And then finally, if you get a negative test result and you're still having signs or symptoms, and we've talked about those as numerous in terms of a fever, cough, shortness of breath, it's important that you keep monitoring your symptoms and making sure that they're not getting worse. And at that point, you should call your doctor to find out whether you should stay home and keep isolating or potentially be retested. There is a potential for negative test results. Again, with our information, it's not clear what that percentage is. But again, if you're having signs and symptoms consistent with COVID, we would recommend that you still continue to self-isolate even with that negative test. So if you are having signs or symptoms, or if you've been exposed to somebody with COVID, this is your opportunity with all these testing sites available to go out and get tested. Again, it'll indicate whether you have the disease. And what happens at that point, as mentioned, is it brings on the public health system to help you determine your isolation period, but more and equally important then is to also identify the people that you've potentially exposed so we can stop transmission beyond that point. If you need to know where the testing sites are, Mayor Barrett mentioned 211 has a great website where you can get the information from their website. You can also call them directly and get information about the most the most or the closest testing site to you, or one that may be convenient for you through your healthcare provider. So please do get tested. We do want to know from the community how many cases of COVID we have out there. It will also help us to determine when we're going to be able to move into our next phases. So please continue to be safe and get tested if you need to. Thank you.